Hi folks, welcome to my channel, Walk with Doc. Today we're not going to cook food, but we're going to study food and health. Did you know that what you eat is what you are? I'm going to go ahead and show that to you today. Clicking this video is not a coincidence. You might probably suffering from joint pain, or probably you're just curious about this disease. Try to check the following symptoms if you haven't. Intense joint pain, lingering discomfort, inflammation and redness, limited range of motion, and a high uric acid in the blood. You might have already watched a lot of overwhelming, overpromising, overnight scheme on wonder drug, wonder food, and sometimes misleading videos on gout. So I recommend for you to watch this full video up until the end in order for you to know some of the documented facts on lifestyle, home remedies, my own experience based on mayoclinic.org, and my buddy here, Harrison's book of internal medicine. Gout occurs when uric crystals accumulate in your joint, causing the inflammation and intense pain of a gout attack. Uric crystals can form when a high level of uric acid is in your blood. Your body produces uric acid, and when it breaks down purine substances that are found naturally in our body and stuff we eat. Normally, uric acid dissolves in your blood, passes through the kidneys into the urine. But sometimes either your body produces too much uric acid or your kidneys excrete too little uric acid. When this happens, uric acid can build up, forming a sharp, needle-like uric crystals in the joint or the surrounding tissue that cause pain, inflammation, and swelling. I'm going to tell you some of the risk factors that bring about gout. You are more likely to develop gout if you have a high level of uric acid in the body. And factors that increase the uric acid level in the body include diet rich in red meat and seafood, and drinking beverages sweetened with fructose, also known as fruit sugar, increased levels of uric acid, which increase your risk of gout. Alcohol consumption, especially beer, also increases the risk of gout. Obesity. If you're overweight, your body produces more uric acid, and your kidneys have more difficult time eliminating uric acid. Medical conditions. Certain diseases and conditions increase uric acid in the blood and increase your risk of gout. This includes untreated high blood pressure, chronic conditions such as diabetes, metabolic syndrome, heart and kidney diseases. Certain medications can also increase uric acid in the blood. The use of thiazides diuretics, which is commonly used to treat hypertension, can also increase the risk of gout. Low dose of aspirin can also increase uric acid levels. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. Family history of gout. Both of my parents have history of gout, so I'm a really 100% candidate. If other members of the family have had gout, you're more likely to develop the disease. Age and sex. Gout occurs more often in men, primarily because women tend to have a lower uric acid levels. After menopause, however, women's uric acid levels actually approach those of men. Men are also more likely to develop gout earlier, usually between the ages of 30 and 50. Whereas women generally develop signs and symptoms after menopause. Recent surgery or trauma. Experiencing recent surgery or trauma has been associated with an increased risk of developing a gout attack. Though gout is a very manageable disease, you gotta take it seriously, or it'll take serious on you. Because people with gout can develop more severe conditions, such as recurrent gout, advanced gout, and kidney stones. While some people may never experience gout attack signs and symptoms again, on the other hand, some people may experience gout attacks several times each year. Medications can help prevent gout attacks in people with recurrent gout attack. In advanced gouts, deposits of uric crystals can form nodules underneath the skin, and they're called tophi. Others call it tophi. It doesn't look good, but it sounds yummy to me. And tophi are usually aren't painful, but it can get swollen during the gout attack. Tophi can develop in several areas such as fingers, hands, wrists, and elbow. Medications is pretty helpful for people with gout attacks, especially with recurrent gouts. However, if left untreated, it can cause bone erosion and destruction of the joint. Uric crystals can also accumulate in the urinary tract of the kidneys, forming kidney stones. However, medications can prevent them from forming.
Diagnosis. The most practical way of knowing or measuring the levels of uric acid in the blood is actually through blood extraction. Your doctor may recommend a blood test to measure that uric acid in your blood by getting blood from your veins. X-ray imaging can also be helpful for ruling out the causes of joint inflammation. Musculoskeletal ultrasound can detect uric crystals in the joint or in the tophus or tophi. However, this technique is widely used in Europe but not in the United States. Dual energy CT scan. This type of imaging can detect the presence of uric crystals in the joint even when it's not acutely inflamed. However, this test is not used routinely in clinical practice due to the expense, and it's not widely available. And the one that is considered as an invasive test, known as joint fluid test. Your doctor may use a needle to draw fluid from your affected joint and then subject it to a microscope to see uric crystals may be visible when the fluid is examined.
Treatment. Treatment for gout usually involves medications. Whichever medications you and your doctor choose will be based on your current health and your own preferences. Gout medications actually can be used to treat acute gout attacks and also prevent future attacks as well. They'll also reduce the risk of complications such as development of tophi and kidney stones from uric crystal deposits.
Medications to treat gout attacks. Drugs used to treat acute attacks and prevent future attacks include non-steroidal and anti-inflammatory drugs, or also known as NSAIDs. NSAIDs include over-the-counter options such as ibuprofen and naproxen sodium, or a very powerful one which is celecoxib. Your doctor may prescribe a higher dose to stop an acute attack or followed by a very low or a lower dose to prevent future attacks. Corticosteroids. Corticosteroid medications such as drug prednisone may control gout inflammation and pain. Corticosteroids are generally used only on people with gout who can't take NSAIDs or colchicine. Side effects of corticosteroids may include mood changes, increased blood sugar levels, and elevated blood pressure. Medications that improve uric acid removal, and these drugs are called uricosurics. You might want to consult your doctor about this.
Prevention. As what they say, prevention is way better than cure. Oh, oops. That is how to prevent it. Now, let me try to tell you all the lifestyle, pretty much helpful lifestyle and home remedies, and also my personal experience on how to get rid of gout attacks. Medications are often the most effective way to treat acute gout and also prevent recurrent gout attacks. However, making certain changes in lifestyle are also very important. During symptom-free periods, these dietary guidelines may help protect against future gout attacks, such as drinking plenty of water. I couldn't thank more my sister-in-law for giving me this wonderful tumbler.
I know it's a cliche to say, drink a lot of water. 8 to 10 glasses of water a day makes a lot of wonder. Limiting alcohol beverages and drinks sweetened with fructose or fruit sugar would really help a lot. Also limiting intakes of food high in purines such as red meat, organ meats, and seafood, especially intestines. I'm gonna make it simple for you guys. Here are your friendly foods and your enemies. Exercising regularly and losing weight, keeping your body at a healthy weight, reduces the risk of gout.
In the medical field, there's such treatment as alternative medicine. Now, if your gout treatment isn't working well as you would have hoped, you might want to try other approaches. But before you try that treatment, you might want to consult your doctor so that you can weigh the benefits, the risk, and learn if that treatment would also interfere with your gout medication. Certain foods have been studied for their potential to lower uric acid, such as coffee.
Studies have found an association between coffee drinking and lower uric acid levels, whether you're drinking decaffeinated coffee or regular ones. Vitamin C. vitamin C supplements may reduce levels of uric acid in your blood. However, no studies have demonstrated that vitamin C affects the frequency or severity of gout attack. You may talk to your doctor about the reasonable dose for vitamin C. And don't forget that you can increase vitamin C by just eating more vegetables and fruits, especially oranges and lemon. Cherries. Cherries have been reported to lower uric acid levels, as well as reduce the number of gout attacks. Eating more cherries and drinking cherry extract may be a safe way to supplement your gout treatment, but discuss this with your doctor as well.
Now, for you to watch and learn more videos on medical information, please like and subscribe, and don't forget to hit that notification bell for the next video. Don't forget to leave your comments below for any medical information that you want to know.